Hello and welcome to your first official lecture of the spring semester for your ALH 8. And we're going to go through this one pretty quickly because you just completed a full class on pharmacology, but just wanted to get your brains moving and thinking again. So make sure you read the whole chapter and hopefully you can refer to all of your notes from our full pharmacology class. So let's just look at a few things that are important. And we'll start with learning objectives. Define and spell pronounced terms listed in vocabulary. Do the following related to government regulation of medication in the United States. So we should be able to already distinguish among the government agencies that regulate drugs in the United States. Cite the areas covered in the regulations established by the Drug Enforcement Administration, the DEA, for the management of controlled and regulated substances. List the DEA regulations for prescription drugs for each of the 5 schedules from the Controlled Substance Act. Explain the medical assistant's role in preventing drug abuse. Differentiate a drug chemical, generic, and trade names. Describe the use of drug references, materials, and explain the 5 pregnancy risk categories for drugs. Discuss the tips for studying pharmacology and define the 5 medical terms used to describe the clinical use of drugs. We have a few more here. Cite safety measures for the over-the-counter. Do the following related to prescription drugs. We should be able to diagram the parts of prescription, which you all are already able to do. Demonstrate the ability to transcribe a prescription accurately. Describe an e-prescription and its method, how that's done. Relate the principles of the pharmacokinetics to drug use. And describe factors that affect the actions of drugs, including the physiologic changes associated with aging. Again, as you can see from all of these learning objectives, we have done this and much more in our ALH 3 pharmacology class, but it's a good way to come back into the spring semester and kind of review. So this will be hopefully a quick lecture today. Remember about government regulations. The Food and Drug Administration is the FDA, and they regulate the over-the-counter and prescription drugs. There is an approval process that includes laboratory testing, toxicity testing on animals, and human clinical trials. Only 1 in about 10 drugs reach the clinical testing phase, and the original manufacturer of the drug is awarded the copyright protection on that particular chemical compound for 20 years. And this means that during that 20-year period, other pharmaceutical companies cannot produce generic copies of the drug. And we, again, have talked about that, but that's just a refresher. Controlled substances and regulations. So according to the Controlled Substance Act, the CSA, which was passed in 1970, a drug or other substance that has the potential for illegal use or abuse must be placed on this controlled substance list. Most controlled substance drugs provide significant assistance to patients in need of their particular action, such as pain relief or anesthesia for surgery. If drugs are lost or stolen, the incident must be reported immediately to the DEA office and to the local law enforcement authorities. And we went over that and kind of how that's done. Here in your book, you can find a list of the scheduled systems of classifications of the controlled substances. And this is, the first part of this is found on, it's actually table 9-1 in your book. And then continuing on, this is the second part with your schedule 4 and 5. So make sure you take a look at these in the book. You can go back and revisit any of your notes from pharmacology that you need to, just to familiarize yourself and kind of test yourself and see if you remember. There are really strict federal guidelines for controlled substances. These specific guidelines apply to both written and e-prescriptions for controlled substances. A written, oral, faxed, or DEA compliant electronic prescription order must include date drug is prescribed, name and address of the patient, and name and address of the DEA number of physician. Amount prescribed must be written out. Provider must manually sign all paper prescriptions, and other specific rules may apply depending on the schedule of drug. That gets a little bit more specific, but again, just kind of reviewing that process. Also, Schedule 2's prescriptions must be either written or e-prescription. It cannot be refilled, may require specific types of order forms for this. The Schedule 3 prescriptions may be ordered orally, in writing, or e-prescription, and may be refilled up to 5 times within 6 months. And Schedule 5 prescriptions may be ordered orally, in writing, or e-prescription, may be refilled up to 5 times within 6 months. Depending on the state, it may also be dispensed by the pharmacist without photo ID. Typically, it's required, and again, that also depends on the pharmacy that you're attending. I want to talk about drug abuse, and this is part of what we're going to discuss within this class, not only for patients, but also for healthcare workers. And it's important that we recognize these and talk about it, because we have actually a high number of healthcare workers that abuse drugs and also struggle with addiction, as well as we need to be able to help our patients and also be able to recognize it within our patients. So any drug can be abused. Many treatment programs are available. Programs include detoxification, rehabilitation, and long-term rehabilitation maintenance. Let me ask you something. What is the difference between drug misuse and drug abuse? So if you were thinking that drug misuse is the improper use of common drugs that can lead to dependency or toxicity, and drug abuse is the continuous or periodic self-administration of a drug that could result in addiction, physical dependency, then you would be correct. Also, what are the different types of dependencies? So drug dependency is the inability to function unless under the influence of the substance. Psychological dependency is the compulsive craving for the effects of that substance, and physical dependency is a person's need to use a substance continuously so that the body can function, and it also can be used to prevent the physical discomfort. And then acute and chronic effects. What are the differences there? So the acute effects is what the person feels when intoxicated or directly under the influence of that particular substance. And chronic effects include temporary or permanent physical and mental changes that result from that long-term abuse. And again, we need to recognize and discuss this throughout this class, because we not only need to be there for our patients, but for ourselves and our coworkers, and also we see it within our families and friends. What is your role as a medical assistant in preventing drug abuse? I want you to think about this and sit with us a little bit through this chapter, and then we will talk about that on Monday in class. Okay, so I want you to kind of take some notes and think about it so you're prepared for that question. As we know, drug names have the chemical name, the generic name, and the trade name. And so a chemical name is that drug's exact formula. The generic name is the non-proprietary name. It's not copyrighted. And the trade name is the brand name, and it is protected by that copyright. So you've already taken a lot of time to study pharmacology, and this is just kind of a review about what we can utilize to get that information with needed. Of course, it has to be that reliable source where we go. So the first and number one most useful thing is that package insert for you as a medical assistant. The medications come with that. You can refer to it. It answers so many different questions about it, and you can reference what you need there. Also, we've talked about the physician desk reference, and it is color-coded in the sections. And we've also talked about the U.S. Pharmacopoeia, National Formulary, and the official drug standards there. So just remember that it's very important that we do use those correct and reliable source references when we need to find out information about that medication. We've talked a lot about pregnancy risk categories, so you should know these already, as well as how age can relate to these medications. Precautions are necessary actions that must be taken because of these special conditions of the patient, the drug, or the environment. You can find this table on 9.2 if that helps you to kind of review the pregnancy risk drug category. Again, we've learned about drugs and we've expanded our knowledge in that way, but we always have more to learn. So some things that might help you is to observe the use of drugs in patient care, how they actually affect a patient, concentrate on the important drugs in each classification. So start to learn similarities and differences and kind of how that works. And the primary actions and uses of the drug are always important to know and understand, especially when you're going to be educating your patients on that. And here's some terms that you can find if you want to look in the book and kind of look over the diagnostic, palliative, all of these, the prophylactic, replacement, therapeutic. Again, we've gone through this in pharmacology, but our book has some great simplified resources for that. So we're going to be looking at dispensing drugs, right? This is something that as a medical assistant, sometimes the doctor orders us to dispense a drug or to give an injection, which is dispensing a drug, and they tell us how they would like it done and have that doctor order. So it can be an over-the-counter, or it might be a prescription. Some important facts about over-the-counter: make sure you carefully read the packages and labels, take only recommended doses, monitor the expiration dates, and never combine over-the-counter and prescription drugs unless prescribed by the physician. You can always also tell your patient to check with the pharmacist if they have any questions or concerns. A lot of times the doctor will also encourage them to call back and put in a message if they have any questions or concerns about those medications. We want to know. We need to communicate. It's very important that we keep all of that together and that we know what medications our patient is taking at all times, because there can be major drug interactions, and with miscommunication, it's much easier for those interactions to cause some major problems. In an attempt to reduce the number of medication errors caused by incorrect use of medical terminology, the Joint Commission recently developed the Do Not Use list of abbreviations. I will tell you that these abbreviations are still used out there in the field, so we kind of need to know them, but we shouldn't be using them for our use as we're learning. But we do need to be able to recognize some of them because our physicians and nurses have been in training for a long time, and sometimes that's a hard habit to break. So we want to make sure that we use the appropriate medical terminology and abbreviations, and also when we're looking at electronic prescriptions and health records. We've done prescriptions. We've written sample prescriptions. You've worked in EHR. We're going to continue to look at SimChart as well. So again, the book provides some great things there. Please review the 6 parts of the prescription and look at this electronic prescription part. EHR systems can create and send prescriptions directly to the pharmacy. It's important that we always update our patient's current pharmacy into the computer. And drug interactions with the body, the pharmacokinetics, how drugs are absorbed. Again, we've spent that time on the class, but this chapter has some great information. Now, intravenous administration, that is not within our scope of practice here in the state of California. You will not be doing any IV administration.